All right, all right. Good morning, greetings from Singapore. Good afternoon, good evening, depending on where you are. I'm Santiago Brand, and I'm very happy and very excited to do this webinar for you today to talk about an introduction to neurofeedback, brain training through neurofeedback. And this is a very special one because if you're interested in the field of psychophysiology, neurofeedback is one of those modalities that you will definitely want to engage in, that you will definitely want to use as a part of your interventions. And today, for this webinar, we want to talk about a few things. So our objectives are to list the benefits of neurofeedback, what is neurofeedback useful for, the uses of neurofeedback, how neurofeedback is associated to operant conditioning, and how you can use operant conditioning to guide the training to help your clients achieve more optimal well-being and a better quality of life. I'll also describe the aspects of brain activity, what's the science in a nutshell, in a very succinct way, what's the science behind neurofeedback. And we also want to talk about QEEG brain mapping assisted training. That's the focus of what we do with the trainings at InMindOut. What is neurofeedback then? Well, neurofeedback, first of all, is a non-invasive therapeutic approach. That's a very important term, non-invasive. We're not targeting, we're not introducing anything into the brain. We're not using electricity. We're not using heat. We're not using anything that goes into the brain. We're just collecting information in a non-invasive way. And we use that information to help train that brain, to self-regulate that brain more efficiently. And the main aspect of neurofeedback is that individuals learn on their own through our guidance how to self-regulate and how to manipulate their own brainwave activity, how to train their brain's electrical patterns to get to a certain point with a specific objective in mind. And it uses a brain-computer interface. That's why some places don't call it neurofeedback. They call it brain-computer interface training or brain gaming. That different people call it different things, but the more general use term is neurofeedback. What are the benefits of neurofeedback? Right? Just like any other intervention, there's a list of benefits. And this, the most important aspect that I want to mention here is that these are all evidence-based. And neurofeedback is supported by 30 plus, even 40 years of research. And the research supports its efficacy for different conditions. Now, it works better for some conditions than others, but it's important that you understand and you know that this is an evidence-based intervention. And one of the main things it does is to enhance cognitive flexibility and cognitive control. And that's very important because flexibility is everything for a human being. If we don't have flexibility and we don't have some degree of management over our cognitions or thoughts, it's very difficult, even impossible, to navigate more efficiently through life. And neurofeedback brain training can enhance those very skills. The other one is that we can provide, through the stabilization of brain activity, symptom reduction or symptom relief. And that's very important because if somebody comes with migraine headaches and at the end of X amount of sessions they're not getting migraine headaches anymore, that's quite significant. Or if they come with migraine headaches every week, they get a migraine headache, but it goes down to one every 6 months. Well, that ends up being quite significant for somebody. But what we provide through the brain training is either we can help you relieve some of your symptoms or we can reduce those significantly. People also report feeling more calm and centered. And this goes to self-regulation. People feel that they can manage their emotions more efficiently. They don't get triggered as easily. The stress doesn't overwhelm them as much. They can sleep better. They can react differently. They don't have to be angry. They don't have to be sad. They don't have to be resentful. And these are all different things that clients report over the course of the brain training with the neurofeedback. It does not require medication. And one of the goals for neurofeedback is to be able to get a person off medication completely. If that is not possible, however, we can attempt and we will work hard to reduce the dosage of that medication as much as possible and reduce the number of medications that somebody's taking. Therefore, we reduce the effects of the interactions of those medications for the individual. And that brings about better quality of life. And so when we can get the medication off, and it is the prescribing professional who makes that decision. If it is not possible because the person needs to take that medication, at least reduce the dosage to improve quality of life by reducing these side effects. Now, another important aspect is that this is individualized and personalized, and that means it's tailored towards the individual needs. In neurofeedback, we do not use a one-size-fits-all approach. At least that's not what InMindOut's methodology is all about. And when we say that is because we take a brain map, we look at your specific brainwave activity, we work with your specific needs. So we don't take the amplifier, we put you on the sensors, and then we randomly do things. We are very meticulous about training your brain based on your needs. And that also involves integrated other aspects, other forms of intervention as well. It's all about brain balancing and brain stabilizing. We don't treat conditions with neurofeedback. We don't cure conditions with neurofeedback. We train and we stabilize and we optimize brain activity. That's the core of neurofeedback. That's what we do. We stabilize your brain activity. We help your brain self-regulate. We optimize your brain functioning so that you can end up feeling better. Now, through the training and the stabilization of the brainwave activity, you can achieve things like symptom elimination, symptom relief, or sometimes be able to get off your medication completely. And that's among other gains. Here are some of the conditions listed where neurofeedback has been proven to be the most efficacious per the peer-reviewed research. All of these conditions have been subjected to peer-reviewed research, and the consensus is that neurofeedback is very efficient, it's quite efficient for these conditions. In some of those, it's better than medication alone. In some of these conditions, works well if it is combined with the medication and other forms of intervention as well. Now, neurofeedback, as I specified before, is a brain training modality. Very important to understand that it's not a treatment, it's not a cure, it's a brain training modality. We're stabilizing, we're optimizing brain functioning. It teaches self-regulation. That's one of the most important gains individuals, clients get with neurofeedback. They learn to self-regulate. They learn to empower themselves to be in control and have better management of their emotional reactivity, of their thinking, of their behavior. It's worked very well with depression. It works very well with anxiety. It's useful for peak performance. If you're an athlete, if you're a corporate, if you are in the performing arts, if you're in music, if you're in dancing, if you are in the special forces, if you're in the military, whatever peak performance realm you think of, neurofeedback can help there. It's useful for addictions. We have good data that support the efficacy for addictions in cutting down the relapse and also getting people to stay healthy and away from addictions for a longer period of time. In the early stages of neurodegeneration, neurofeedback can stave it off. It doesn't cure anything that's neurodegeneration related, but it can slow down the progression if we start targeting it early enough. It's useful for the dampening of neuroinflammation. So anything that's early stage neuroinflammation to middle stage neuroinflammation responds very well to neurofeedback, photobiomodulation, audiovisual entrainment, and different forms of neuromodulation, brain optimizing paradigms. It's been very useful for migraine headaches. In my experience, I've been able to get people to not experience migraines anymore in their lifetimes. For other people, I've been able to greatly and significantly reduce their migraine symptoms. It helps with medication reduction or elimination. That's one of the main goals of our training, because that's also one of the main goals of the client when they come to see us. They don't want to take the medication anymore. Some people don't want to start taking the medication. Very frequently, when I have ADHD cases, the parents tell me, we don't want to medicate our child. That's why we want to use neurofeedback. We don't want to medicate them. We don't want them to rely on the medication. And we find that more and more adults don't want to rely on the medication or don't want to start taking the medication. That's when they come to train their brains with neurofeedback as an alternative. Neurofeedback is also helpful with pain management, stress, or anything that's stress related. ADHD, as a matter of fact, neurofeedback was born out of the need to work with ADHD, and then many things stemmed from there. Useful with epilepsy. We have documented cases where people, after years of doing neurofeedback, are seizure-free, medication-free, and this is something that is stated by the treating neurologist or the treating physician. This is not our claim. This is a claim from some people in the medical field, but it's also been documented through published research. It can help with sleep issues, help you fall asleep more easily, wake up feeling more refreshed, stay asleep throughout the night, get a better quality and quantity in your sleep. Helpful for memory, in some cases, for memory loss and memory reduction or some degree of memory impact. And we also have some very convincing data and efficacious data published for trauma and PTSD. Now, we can work with other conditions, but these are the ones where we have solid research where we can tell you it's a good chance, there's a very high chance that neurofeedback will work for you. Some of the sports organizations that are implementing neurofeedback and biofeedback are the U.S. Olympic Committee. I know a couple of the sports psychologists who work there. The Ministry of Sports in Colombia, where I'm from, and I know this because I worked there with the establishing and setting up the neuroscience lab. Sports Singapore, where I live now, they also have neurofeedback and biofeedback as part of their institution. The Canadian Olympic Committee, the Guatemalan Olympic Committee, and the Bolivian Football Federation. I have the chance to work with some of these organizations in going and training their sports psychologists to use neurofeedback and biofeedback, and they still use it to this day. In the clinical sense, the Amen clinics from Daniel Amen, or Amen, depending on how you want to pronounce it, and the Mayo Clinic use neurofeedback and biofeedback respectively. So we have reputable organizations, not only in sports, but also in the clinical arena, that are using neurofeedback and biofeedback as part of their intervention methodology. And as I said, neurofeedback works with operant condition paradigm, and that means that we reinforce, we reward, or we inhibit brain activity to guide the person, to teach them how to train their own brain. We train them to make more or less of specific brainwave patterns. We teach the brain to fire a little bit more or to fire a little less, and all the brain areas start integrating the information. We foster neuroplasticity. We foster perfusion, blood flow to the brain. We foster the dampening of neuroinflammation. And all of this is done via the rewarding and inhibiting of frequencies. Now, we also do this through a specific feedback, and that feedback is visual, meaning the person can play a video game and control the video game using the brain. They can watch a movie and control what happens in the movie by using their brain activity, and also use music or tones. Any type of feedback that we provide the client with, it's controlled with the brainwaves alone. They're not using the keyboard, they're not using the mouse, they're not using a joystick, they're not using anything external. They're learning to control the feedback through brainwave activity. That makes the training, one, very attractive, two, very effective, because the client is not overly stimulated. They're working with a specific task in hand. And as clinicians who are trained and board certified in this, ensure that we create a training paradigm where the criteria is met, where the brain of the client meets that criteria, and where we drive the brain into better self-regulation, better stabilization, and optimization of brain function. Now, neurofeedback can be used in tandem, in conjunction with things like brain spotting, or EMDR, or psychotherapy, or any other form of neuromodulation, such as audiovisual entrainment, cranial electrostimulation, transcranial direct current stimulation, TMS, hypnosis, you name it. The point is that neurofeedback is not antagonistic to any of these forms of intervention. Therefore, it can be used as another tool which can strengthen your already successful practice and make you even more successful. But also, it can work with clients where other forms of intervention have not worked. I've had clients in my 15 years of experience who've tried psychotherapy, and psychotherapy didn't work for them alone. Some of them started doing neurofeedback plus psychotherapy, and they did much better. Some of them decided not to do psychotherapy anymore, and they tried neurofeedback, and it also worked for them. And that's the importance of making this a personalized and individualized procedure, because people respond better to different things. Some people respond better to neurofeedback alone. Most people respond better to neurofeedback plus something else. Obviously, as we do training, and especially considering that we're doing training on people's brains, it's very, very important to consider certain aspects, to have certain intricacies in mind when it comes to working with people. Now, we need to get information, such as data, brainwave patterns, and we do that through the QEEG brain mapping. We can also do interviews. We can also do psychometric testing. We can do clinical observations. We can do in situ observations. We need to create an environment where we can have a plethora of options to get as much information as possible. We also sometimes refer clients to functional medicine practitioners to get blood work for food insensitivities, for food allergies, to get a blood work panel and a profile for the neurotransmitter. In essence, the more information we have, the better. But we have very, very useful and state-of-the-art technological tools that help us gather information about the client in a non-invasive, very practical way. So normally we have a series of steps when we are using the QEEG, and these are sort of technical terms that we throw out amongst ourselves. But when we're feeding back the information for clients, we're trained and mindful of being just very succinct and use layman's terminology. We will describe everything we're seeing in brain map in words that the client can understand, in words that can be relatable to them, that would help them make sense of why they're seeking our services. But if you decide to come for neurofeedback training, these are some of the technical words and the technical jargon that you will be learning and you will be using for as long as you're doing neurofeedback. And this slide basically shows some of the images that we can see when we're working about neurofeedback. And again, you can see the terminologies such as waveforms, continuity, symmetry, resting frequency. These are terms that are more important for you as a clinician when you learn neurofeedback. They're not so important for your client. You learn to translate this into more relatable language to the client. Or if you're doing a presentation for people who are not science-oriented or science-informed or science-inclined, you use more specific, easier to understand terminology. But this is just to show you that once you start getting into neurofeedback, you will get into very specific technical language, which ends up being quite useful because you need to learn how to read a brain map, you need to learn how to read brain activity, and you need to train that brain activity in an ethical and responsible manner. That's why not only we offer the trainings, we offer a pathway to board certification. And I will talk about that at the end of the presentation. Now, again, we have terms like states of consciousness, and those are associated with brainwave patterns. When you start learning about neurofeedback, once you get into this field, you will learn about delta waves and mu waves and gamma waves and kappa waves and theta waves. And you will learn to see how each of these brain states are associated to different states of consciousness or learning or sleep or memory or anger or depression or whatever a human being does. It's really tied very closely to the brainwave states. And we study that. We train it to help the people that we work with, again, achieve a more optimal quality of life and whatever objective they have in mind. We also use tools to help the assessment to test for different things. And this is a test that can be used in conjunction to the neurofeedback as a baseline form of assessment to see where your client is with their general cognitive performance, their brain processing speed. Are they processing at a speed that is expected for their age, that is neurotypical, or is it below their neurotypical expected performance? It tests brain plasticity, how malleable, how flexible, how plastic your brain is, how easily is your brain learning new things, or not so. How fatigued you are from a cognitive perspective, from a physical perspective, how focused you are. And again, different clinicians use different combinations of methodologies. But when you take the trainings, we mention all of those options. We provide you with information as to what's out there, and then we can guide you in helping you choose the best tools possible depending on your budget, your interests, and your goals in mind. As I said, we use QEEG, quantitative electroencephalography, also known as a brain map, also known as a brain scan. And that's one of our most important assessment tools to plan for neurofeedback. So QEEG, quantitative electroencephalography, aka brain scan, aka brain map, is an assessment tool. It uses a minimum of 19 channels, meaning we have 19 electrodes, as you can see on the cap in the picture, placed in strategic locations on the scalp. We use filters to be able to see that information clearly and understand it. And it provides very useful information. It provides a wealth of information on epileptiform discharges. Maybe you can find slow focus. We can find transients, encephalopathies, sleep disturbances or disorders, neuromarkers, biomarkers. And it also provides 3D images, topographies, and maps of the brain that you can use to explain to the client what is happening to their brain. Hence the reason why they're coming to seek your services. What I like about brain mapping is that I normally don't gather a lot of information about the client, and I always only ask about their name, date of birth, and a couple of specific questions. I don't ask them and I don't let them tell me their history because the brain map will do that for me. One of the most salient and attractive features of a QEEG brain map is that you can tell the person a lot about themselves without knowing them, even if you're meeting them for the very first time. The brain will do the talking, and then you will translate that to the client in a relatable manner. And that helps create a lot of credibility. It builds up credibility on you as a practitioner, and it provides the client with the hope that this could be a solution, or at least a part of the solution, to their complaints. This is what an EEG would look like. The QEEG starts with the electroencephalogram, and you need to distinguish which of the images or which of the activity that you've shown that you have in front of you corresponds to real brain activity. This here on the left is just eye blinks and muscle tension, and this to the right is an epileptiform discharge, is an epileptiform paroxysm. And you will learn to read this, you will learn to interpret it, and you will learn to refer to the proper professional, but also to create brain training neurofeedback protocols to help the person. You can also get very nice images. These are called components, which show you the raw EEG tracing for that region of the brain, the electrical activity. It shows you the distribution into a graph called the power spectrum, which just means where the brain is more active or less active. It shows you the image. Here's the nose. So this is the frontal cortex, the right ear, the left ear, and the back of the brain, the back of the head. And we see that we have a lot more activity here on the left sensory motor cortex. It shows you subcortically with the red dot where the activity is coming from, and it gives you specific coordinates, specific voxels, which tell you with pinpoint accuracy the area of the brain that is affected, what it corresponds to, and what kind of activity and functioning is being impacted. We can also create maps, color-coded maps that indicate where your brain is working efficiently or where it needs some fine-tuning. And it uses a statistical scale which indicates that the green is the efficient areas of the brain. Anything that's green on these topographies is working well, but as we get into the red or the intense orange, it indicates the regions of the brain that need the fine-tuning. For instance, this person needs some fine-tuning in his alpha or her alpha brainwaves in the right frontal cortex and the right sensory-motor region, on the left temporal-parietal junction, which would be have a negative impact on short-term memory. They have a little bit extra beta frequencies, which would make them more prone to anxiety, more prone to panic attacks, things that are more on the sympathetic fight or flight end of the spectrum. And you go from the raw EEG to the more specific maps, and then now you have a guided system to have a more efficient intervention. You can buy software that gives you 3D renderings of the brain, and it gives you a color-coded scale. It gives you specific coordinates, and it tells you the areas of the brain that you're better off targeting. And not only that, it provides you information on the intensity that you need to target, the frequency, the duration, and so on and so forth. So that's how neurofeedback works in a nutshell. As you can see, the technology is quite fascinating. It's interesting. You have tons of options in the market, again, depending on your budget needs. And that's where we come in. If you start doing neurofeedback down the road, at some point in your career, it will be in your best interest to become board certified. Board certified ensures that your reputation, that you're more reputable, but also more respected and have better outcomes in terms of client work, because it will ensure that you follow a specific path. The specific path requires you take a didactic certificate course, which is usually 36 hours and is a combination of theory and practice. We offer those throughout the year. That you also get the equipment. And again, depending on your needs, depending on the population you want to work with, depending on your budget, we can guide you into buying appropriate FDA-approved, FDA-registered technology that you will use in a responsible and ethical manner. You need to get a mentor. You must get a mentor. And InMindOut has a team of mentors with years and hours of experience in different conditions, different modalities. You hire a mentor for a specific number of sessions. Your mentor signs off on your hours. And then you take the BCI exam, the Biofeedback Certification International Alliance, which is the governing body for us in the biofeedback and neurofeedback field. So the pathway is very straightforward. You take the class, you get the equipment, you start working with friends and family, you start working with relatives, you start working with clients, you start getting your mentorship hours. Once you get enough experience and you're confident, you take a couple of extra online classes on ethics and physiology. And once you feel you're good and ready, you go take the exam. And if you pass the exam and you meet all of the criteria, congratulations, you're board certified. And you need to get recertified every 4 years, which requires you to do continuing education hours. You can take more mentoring, you can attend webinars, you can attend conferences. But once you get certified, you will go into BCIA's website listing. So if somebody is looking for a BCIA certified mentor or practitioner, then you can mentor other people and you can obviously be part of that elite listing. If you're more interested about this, you can contact Kelly Feely at Successful Practitioner. You can book a free 25-minute consultation. You tell them, Kelly, I'm interested in neurofeedback, in biofeedback, but I am very confused. I don't know where to start. Can you please help? That's what the 25 free-minute consultation is for. He will guide you through the process. And then on the left, you can see the trainings that we have for the remainder of this year. Yours truly will be teaching some of those and co-teaching some of those in September in San Antonio, Texas. So if you're interested, please contact Kelly, sign up for the training, and we will be more than happy to meet with you and get you on the path to success. With that in mind, I want to say thank you, and we'll see you very soon. You guys have a good evening.